So let's try to understand cyanotic spells occurring in tetralogy of fallot with the help of this really simple flowchart here, and it's going to become really simple after this, trust me. So in the previous video we have seen that the main problem in tetralogy of fallot is a cyanosis that is occurring because of a stenosed infundibulum, which is the starting part of the pulmonary artery. Now whenever there is going to be exertion or the baby is going to do some activity, the right ventricle has to put extra pressure to push the blood through the pulmonary artery. Now this extra pressure on the artery is going to bring about the spasm of the infundibulum, which means it's basically going to close it shut, and now the blood flow is going to stop. And when the blood flow stops, the existing hypoxia is going to become worse, and that is going to lead to a buildup of lactic acid, which is going to bring about metabolic acidosis. And we have read that the main compensation for metabolic acidosis is going to be hyperventilation to bring about, the washout of carbon dioxide, and that is going to occur by stimulating the respiratory center. And we also know that hyperventilation is going to lead to an increased venous return, and that is going to increase the pressure on the right side of the heart, and that increased pressure is going to worsen this infundibular spasm even more, and that is basically, as you can see, is going to become a vicious cycle, and that is what we call as a cyanotic spell. Now we can see that squatting is going to temporarily bring about relief. Now how is that possible? Well, when you squat, you're basically going to obliterate or partially put pressure on the inferior vena cava, and that is basically going to increase the peripheral resistance, right? So now the left side of the heart is going to be putting more pressure than normal to overcome that peripheral resistance. So basically the main mechanism over here is that we're going to increase the left side pressure of the heart, so that the blood which was flowing from the right to left is going to temporarily reduce and bring about some temporary relief. And so we can also see the treatment over here, which is really simple. So for the hypoxia, we will be giving oxygen inhalation. For the metabolic acidosis, we will give sodium bicarbonate. To depress the respiratory center, we give morphine, and to relieve this infundibular spasm, we're going to bring about some beta blockers, and that is going to help treat the cyanotic spell. And thanks for watching, and subscribe.